The hard part about brain injury is that it not only comes with physical mobility challenges, there's also cognitive changes as well as behavioral appearances that you have to manage at the same time. So the question becomes, how do you manage all three of these things? And the rest of the slides presentation is going to take the cognitive as well as the behavioral. I'll cover management of the physical mobility challenges in a different slides presentation. So moving on, we also talked about cognitive problems, and one new movement system diagnosis that we're seeing specific for brain injury is going to be a cognitive deficit. With the cognitive deficit, the patient's not able to follow instructions, or they can't change their movement in any way due to a cognitive deficit. They also might not be able to remember any instructions. So for cognitive problems that you're going to deal with in patients post-brain injury, the next several slides are going to offer ideas for interventions based on the patient's Rancho level. In patients in Rancho's level 1 through 3, here are a couple of ideas. Essentially, you want to work on positioning, stimulation, as well as range of motion. Okay, with positioning, you're attempting to orient the patient to the environment through different kinds of positioning. Essentially, you can try semi-side lying, where the patient's rotated about 45 degrees, so either the right or the left side. You can try full side lying. You can try a semi-recumbent position. Typically, you can just convert the bed and bring the head of the bed all the way up. You could also try sitting at the edge of the bed, as well as something called a tilt table. Okay, with a tilt table, the patient starts in a supine position, and then you slowly increase the elevation of the head of the tilt table. This allows the patient to be completely safe. They don't have to do anything. They're fully strapped in, but you can bring them all the way to an upright position if needed. It's important to remember that if you are doing any kind of a sitting intervention or tilt table intervention, to make sure to monitor vitals for the patient to see how they're adapting to the upright change in posture. As far as stimulation is concerned, you're attempting to or facilitate any kind of response that you get from the patient using a painful stimulus. We've talked previously, or you learned in CP3, about using a sternal rub or a supraorbital pinch or a nail bed pressure. You could also use olfactory stimulation. We've talked about previously the use of familiar, pleasant smells that the person likes. You can use perfume or scented candles if they're available. You can also try some sort of visual stimulation. And with this, you can just attempt to flash a light over the patient's eyes to see if you can get any responses. And with stimulation techniques, it's important to remember to vary the techniques or the activities that you're using for the patient. And you could also educate the family on the importance of trying these techniques with the patient. And the last idea for Rancho's level 1 through 3 would be range of motion. Okay, you definitely want to start with your passive range of motion, especially in Rancho level 1 and 2, and you want to progress to active assistive range of motion. Okay, as the person progresses to Rancho level 3, remember they're going to start to be able to follow some commands. As you're doing range of motion, you definitely want to be talking to the person consistently and making sure that they know what's happening. Even though they might not be responsive at any time, it's important to just keep talking to them, okay? And keep asking them to help you as much as they're able. When you start to feel that they might be starting to help you a little bit, that's a really good sign. As far as working with patients in Rancho's level 4 and 5, I have a couple of ideas here, and depending on the Rancho level. Now remember, Rancho Level 4 is going to be highly volatile, so you want to make sure that you're within comfort for the patient. Okay, this is going to be the person that you want to maybe work in a quiet treatment room with. Make sure that they're not agitated with anything. And if they do start to get agitated with you, then one simple strategy is to just go ahead and walk out of the room just for a little bit and then walk back. Chances are good they might not even remember that they were agitated with you previously. For the first strategy for a lower level Rancho 4, you can have a significant other or family member fill out a personal questionnaire. Okay, this questionnaire can include information about the patient's pets, any family names, their previous occupation, that sort of thing. And while you're working with that patient, then you start asking some of those questions in treatment. And as you are able to work with this patient and you're trying to help them remember these things, you can progress to other questions. Maybe ask about their daily schedule and how therapy is going. And then progress to any kinds of questions that makes them think about life outside of the hospital setting. For example, discharge plans or anything they might enjoy watching, maybe sports on TV. Okay, as the patient starts to progress from, hopefully, Rancho Level 4 onto Level 5, you can start asking the patient specific questions about their status. So, for example, if they have a weight-bearing status that they have to maintain, or if they're using any particular assistive device, if the patient is understanding that they need to use this assistive device at all times. For example, every time before standing with the person, you can explain their weight-bearing restrictions and ask them to explain to you why they're having this problem. You can have family and other professionals question patients about their weight-bearing status throughout the day to make sure that they're getting it and remembering that this is important. You can also incorporate transfers using whatever AD that they are recommended to use and vary the height of the different surfaces. See if the patient has any carryover of using the assistive device and maintaining their weight-bearing status in different situations. That's an example of a higher level Rancho 4 or somebody who's just progressing into Rancho Level 5. As the patient progresses through higher level 5, you want to start keeping an activity log of the person's daily events and treatments. Okay, not only with physical therapy, but maybe with speech and occupational therapy as well. So as the patient is performing therapy with you, it would be a good idea to just have them tell you what they've done so you can keep a record of it. And then at the end of the session, you can explain what the activity log is and what you're writing down, and then have a family member or a friend review this at the end of the day with the patient to help them remember what they did. At the end of the session, you can have the patient recall specific parts of the treatment session. See if the patient is able to, then they might be able to fill out a few things themselves, and they might need a little bit of and as time goes by, you would hope that they wouldn't need as much prompting or reminding to what was done during the treatment session. Okay, progressing on to Rancho Level 6. Now, remember, in Rancho Level 6, new learning can happen. So you want to work on things like memory and problem solving, different functional tasks, and most important, safety awareness. Okay, with memory, at the start of the treatment session, you can ask the patient to remember two things, say cake and rabbit. And then later on in the session, after 5 minutes go by, then have the patient recall what those two items that you asked them to remember were. Those two items, maybe after 10 minutes, try it again. And then maybe at the end of the session, ask if that person can remember what those two items were called. As far as memory is concerned, you want to ask the person what the steps are for simple activities, like going from sit to stand from a wheelchair. So making sure their brakes are locked, their feet are under their knees, they scoot to the edge of the chair, nose over toes, whatever. Or another idea for memory would be to have the person walk with you, if they're capable of it, to a specific site. So for example, let's walk to the therapy gym from the patient's room, or let's walk to the dining hall and see if that person can actually take you to the right place. Other ideas for Wrenchell Level 6 would be anything in a problem solving. So can they pick out blue cones from cones of different colors? Is the person able to recognize not only cone color, but different objects? So for example, you can hold up a ball and a cup and see if that person is always able to identify or pick up the right object. Okay, another idea would be to place cones all around a therapy gym and walk around and see if the person can find all the cones. And as time goes by, you want to progress from simple to more complex, and as much as you can, see if you can make it functional. Go ahead and pick up an object, say a ball or a book, and carry it over to a different space. Another idea would be to use another object. So let's say you have a basket, maybe a laundry basket, have the person some towels in the laundry basket, pick up the laundry basket, carry it to a different space, and then possibly start folding the towels. And then maybe organizing them on shelves where they're going to reside. Okay, most important is going to be safety awareness, emphasizing memory or recall with safety related especially to functional tasks as much as possible. If there's a weight-bearing status, keep harping on the weight-bearing status until that person can remember their weight-bearing status. You know, another thing that you can do is Simon Says type activities where you're asking them to do something that might be against safety and see if they can remember that they have these precautions in place. Okay, moving on to Wrenchell Level 7. Here you're going to be working on higher level activities, anything that has to do with gait. You can do problem solving, you can do obstacle courses, you can do dual tasking, especially any kind of cognitive dual tasking. So in this particular case, if a patient is recovering from a brain injury, instead of counting backward from 100 by sevens, I might ask them to count forward from 1 while we're walking. Again, any kind of balance activity, you can do sitting balance activities where you're incorporating reaching. You can do standing balance activities where you're reaching outside the base of support. Any kind of stair training, using theraballs, maybe for sitting, using a wobble board, maybe helping them get their higher level balance skills back. You can also incorporate memory. Again, ask that patient to recall objects and recall any steps that they need to set up for a transfer. Still appropriate for Wrenchell Level 7 is going to be your memory walks, where you're asking the person to take you to a specific location in either the gym or in the hospital setting. Okay, continue on with your problem solving with Wrenchell Level 7. So different color cones, different kinds of objects, finding cones placed around the treatment gym. Again, your complex functional tasks, whether it will be folding laundry or carrying books to a shelf and putting them, let's say, in size order or color order. Safety awareness, red light, green light kinds of activities, Simon Says kinds of activities, those sorts of things. And then finally, moving on to Wrenchell Level 8. Here, your main goal should be to increase the attention to more than an hour with familiar tasks. You want to increase independence with anything that isn't familiar and encourage them to make decisions without your assistance. And you want to, as much as possible, decrease their self-centered attitudes. If they have irritability still, or they tend to argue, or they have difficulty with communication skills, then this is something you also want to work on with that person at that time, because remember, you're having them get ready to be reintegrated into society. To do these things, you want to increase your treatment times by adding about 5 minutes every treatment session. You might want to begin your therapy with something that's familiar and fun, and then increase the novelty of the activity or the complexity of the activity. Another idea would be to give the patient some options about what they'd like to do, have them choose from 3 different things that they can do, and then do whatever one that they want first. Okay, you can also progress by adding some therapy time in a more distracting environment. Add in more unfamiliar tasks. Don't give them as many choices for activity, and start making the choices for them and see if they're okay with that change. As time goes on, any kind of functional task that's very difficult for the person and complex is where you want to go to. Whatever that person is going to be expected to do when they discharge from the hospital setting, then that's it. That's what you want to work on to get them ready to do those things. Those are all the example activities that I have for the different Rancho levels. And let's move on to the last area that you have to be familiar with when working with a patient post-brain injury, and that's going to be their behavior problems. They're kind of unusual, I suppose. Working with behavior problems in an adult is almost like working with a young child. They don't know right from wrong. So some of the general principles I like to use are listed here on this slide, where you don't want to overstimulate them. Okay, you slowly increase the amount of stimulation that you get for the person. So in the beginning, with a lot of behavior problems, or if you want to minimize your behavior problems, start in a quiet treatment room, start with a dimly lit environment. You also want to make the tasks familiar, especially in the beginning. So here you're going to provide stability and consistency of tasks until that person is able to learn new things. Hard to do is model calm and controlled behavior. Sometimes it's very difficult when you have a patient yelling at you or hitting you or something like that to stay relaxed. It's okay. And, you don't really reprimand them as much as, tell them that behavior is not acceptable, and, that you have to do that in a calm, collected fashion. Remember to take advantage of distractibility is a big one. Distraction can be used for lots of different things. If you find that a person is getting irritable or their outbursts are increasing, change the subject, change the topic, change what you're doing, leave the room for a minute, come on back. They might not even remember that you were there. Expect everything and anything can happen, and try and be prepared for whatever does happen. And again, stay calm and controlled. The last thing I think is really important to think about, and that is the behavior and the cause of the behavior. And over time, these connections can be made. So for example, if the person is very irritable, it could very well be due to overstimulation. And if the person is asking the same questions over and over again, they might just have a need for attention. Okay, so if you can understand the cause of that particular behavior, that's a very direct route to working on extinguishing the behavior. Moving on, some common behavior problems and some ideas for the management of these problems are listed on the next 2 slides. One problem is irritability. Okay, if the person's really irritable, you want to decrease the amount of stimulation that you're providing. You want to work with them in a nice, quiet, calm area. You can provide reliability, no changes or surprises. If you're working for somebody who's highly irritable, you want to keep it really simple, straightforward, so that the person knows exactly what's coming. Oftentimes, it's a good idea to talk to them and tell them what's going to happen so they know what to expect. And finally, distraction. Distraction works great. As I've said previously, you can leave the room, come right back, or change the topic completely and find a safe area to work in. If the person's demonstrating impatience, okay, they really need to have something done right now. Okay, try to have the person not be focused on any set time frame for completing a particular process. Even though they might want to have it done now, tell them it's okay. You know, we have an hour. It's going to take us a little while. Let's think about what we have to do in order to complete this before we, have to have a time frame that it has to be done by. Okay, and if you have any kind of outbursts or abusiveness from the patient, just ignore any kind of swearing or foul language, because if you make a big deal about it, that's just reinforcing their behavior with your attention. Okay, so as much as you can, try to ignore it and stay calm. Never accept any physical aggression, and don't retaliate and become combative yourself. If you're in a situation that the patient is becoming physically aggressive with you, the best thing to do is make sure that they're in a safe place, leave the room, leave the environment, give them a chance to calm down. Other problems to be aware of, I talked a little bit about perseveration, and this is where a person's going to tend to focus on a specific topic. The reasons for perseveration might be just due to a need for attention. As I said before, they might have a poor memory, and some strategies to deal with it. So provide an alternative means for having that person hold your attention. Provide them with some reassurance that the whole brain injury, the whole process that they're going to is everything's going to be okay. It's going to work out. We just have to take it slowly. If somebody's perseverating over a specific thing and nothing seems to be working, one idea is to say, okay, I know you really want to talk about this, but we have this to do right now. And maybe the last 5 minutes of therapy, we can sit down and talk about whatever topic that the person's perseverating on. Another very common behavior problem is going to be childish or crude behavior. Let's say that the person is doing something that is definitely not socially acceptable. So, for example, taking off their clothes in the middle of the gym or making obscene or crude gestures. You definitely want to warn anyone else who's going to be working with this patient that this is a problem, right? And you want to calmly and controlled remind that patient that this behavior is socially unacceptable and it's something that you won't tolerate during therapy with them.